Magad go hirirlí agus go magad a socht an deis thuirt dom an táhair seo ordu an achló an Shasta Shannon. Thank the Chairman for allowing me to raise this matter in the Shannon. It's a very important matter. It's a matter that's very much in the news over the last week is in relation to the primary healthcare centres and where we have the row ongoing between Minister Riley and Minister Shortall. I think at the end of the day the public need primary healthcare. And I'm particularly concerned about the centre at Kells in County Meath, which I understand and I'm glad was added to the list of healthcare centres by Minister Riley. I think he made the right decision. But I do want to know what reality is there to that decision, because there was a number of efforts made over the years to get a primary healthcare centre in place in Kells, to launch a PPP model in conjunction with local doctors, and nothing came of it. And my colleagues on Kells Town Council, Councillor Sean Drew and Councillor Brian Riley, Councillor Frankie Lynch, put forward a motion calling on Minister Riley to establish a primary healthcare centre in Kells. That motion was passed the Town Council and indeed was forwarded on to Minister Riley. So perhaps in response to those representations, Minister Riley decided to reinstate this healthcare centre on the list. So I would like to know the upstate position. I think the people of Kells deserve to know the upstate position. I think with all the brouhaha and unnecessary brouhaha about the provenance of the list, I think the people in the individual towns want to know what's happening in their town. Will they be getting the health services that have been promised and that they deserve?
Tara. Well, I want to thank Senator Byrne for raising this question, and I welcome the opportunity to outline the current position with regard to Kells Primary Healthcare Centre. As you'll be aware, the Programme for Government sets out this Government's commitment to ensuring a better and more efficient health system, a single-tier health service that will deliver equal access to health care based on need, not income. In a developed primary care system, up to 95% of people's day-to-day health and social care needs can be met in the primary care setting. And the key objective of the primary care strategy is to develop services in the community that will give people direct access to integrated multidisciplinary teams of general practitioners, nurses, physiotherapists, occupational therapists and other healthcare disciplines. And this is central to this Government's objective to deliver a high-quality, integrated and cost-effective health system. A modern, well-equipped primary care infrastructure is central to the effective functioning of primary care teams. These teams enable multidisciplinary services to be delivered on a single site, providing a single point of access for users and encourage closer coordination between health providers. The infrastructure development through a combination of public and private investment will facilitate the delivery of multidisciplinary primary health care and represents a tangible refocusing of the health service to deliver care in the most appropriate and lowest cost setting. And the intention to date has been that where appropriate, infrastructure for primary care centres would be provided by the private sector through negotiated lease agreements. The Exchequer will also fund the delivery of some primary care centres, particularly in deprived urban areas, small rural towns and isolated areas. In addition, a list of 35 potential locations for development by way of public-private partnership as part of the Government's infrastructure stimulus package was published in July. The provision of a primary care centre in Kells has been progressed to date by way of a private sector operational lease process, and submissions were assessed by the HSE and a preferred provider who was identified and who satisfied the HSE's key criteria and offered acceptable accommodation in development at a suitable location on the Dublin Road in the town of Kells. An agreement for lease was reached with the preferred provider in 2010, and planning permission was received for the development of approximately 30,000 square feet in size. However, the preferred provider has not, to date, been able to deliver the new primary care accommodation, due mainly to funding difficulties. The HSE continues to engage with the preferred provider in the hope that the facility might be delivered within the timeframes of the agreement. And whilst the HSE continues to consider the possibility of delivering the centre by the private sector operational lease process, it's also considering alternative mechanisms and opportunities, including the public-private partnership process. Kells is included in the locations being considered by the HSE for the Government's infrastructure stimulus package, and accordingly the HSE is now engaging with GPs in the area to assess GP interest and determine how best to proceed to deliver primary care accommodation in Kells.
Senator Byrne.
Well, I will just thank the Minister for his reply. He acknowledges the work of his former party colleague Mary Harney. A lot of his colleagues don't do that, but she certainly did a lot of work in Kells in relation to this, and unfortunately the private sector let her down. I would be concerned that the HSE seems to be continuing negotiations there where there may be no reality to the negotiations. But I make one final point. The Minister promised, and Deputy Hannigan and Deputy McEntee promised the primary healthcare centre to the people of Kells, and I'm going to continue to fight to make sure the government delivers on that promise. And the people of Kells won't accept the vague language that's in that speech today, because very specific promises were made. We're going to hold the government to those promises.
Thank you, Senator. And Tara?
I have delivered a number of speeches in this House over the last year and a half. That is, I would argue, is one of the least vague I have delivered in my time here. The HSE is actually working closely with GPs in the area, and we have to assess what the GP's interest is, what is the resources they may have to deliver a primary care centre. And I've been assured that the HSE is being as creative and as innovative as it possibly can in securing the best possible solution in the shortest time frame to provide a centre in Kells.